Why are sputum cultures important for CF exacerbation treatment? Imagine trying to fix a puzzle without knowing what pieces are missing. That's similar to managing lung infections in cystic fibrosis without proper testing. Sputum cultures are like a detailed map that shows exactly which bacteria or fungi are causing trouble in the lungs. These infections are common in cystic fibrosis because thick, sticky mucus traps germs, creating a perfect environment for bacteria like Pseudomonas aeruginosa and Staphylococcus aureus to thrive. During an exacerbation, when symptoms suddenly worsen, knowing the exact germs involved helps doctors choose the right antibiotics. Without this information, treatments might miss the mark, leading to less effective care. Getting a sputum sample involves patients coughing up mucus from their lungs. Sometimes, if patients have trouble producing sputum naturally, doctors can use a process called sputum induction, which helps stimulate mucus production. Studies show that sputum induction can detect more pathogens than simple cough swabs, especially in children or those without obvious symptoms. In fact, about a quarter of the time, pathogens found in sputum samples weren't detected in previous cough swabs. This can lead to changes in treatment for nearly a third of patients, making sure they get the most effective antibiotics. Sputum cultures also help track how lung infections change over time. If a patient is on antibiotics, the results can show whether the treatment is working or if adjustments are needed. Since bacteria in cystic fibrosis lungs often develop resistance to antibiotics, knowing the current infection profile is essential. It allows doctors to tailor therapy specifically to what's present, rather than relying on guesswork or standard treatments that might not be effective anymore. In summary, sputum cultures are a vital tool in managing cystic fibrosis lung health during exacerbations. They help identify the exact germs causing infection, guide personalized treatment plans, monitor infection progress, and improve overall lung health. This approach aligns with best practices recommended by health authorities to reduce lung damage and improve quality of life. Always remember, interpreting these results should be done by healthcare professionals who can consider each person's unique situation. If you or a loved one are managing cystic fibrosis, regular sputum testing can be a key part of staying ahead of infections and maintaining well-being.